Coming to the next aspect, or the next challenging aspect, is a thyroid problem. See, I have to tell the story at my end also.
Right.
I'm a pediatrician, right? I've seen that a lot of children are having thyroid issues nowadays.
Right.
So I'll tell you about my story.
Yeah.
And then I think you can add a few things. Right. My story is my elder child. As I said, we are very conscious about what goes in and what goes out, the diet, the food, and all that stuff. So he's being our first child, and we were always very conscious about what is going in. We actually avoided junk and stuff as much as possible.
Yeah.
So we always assume, because we are not giving him any junk, we are very conscious about what is going in. He's always on the leaner side, and he is not taller.
Okay.
For a long time, that my child was not actually growing tall. Okay. And I've seen that even my clothes don't change. But I always had a suspicion that maybe he's having some hormone issue. Why is he not growing?
Okay.
So whenever I wanted to do a test, my wife was against it, saying that no, it's okay. My grandmother, my grandfather are also a little bit shorter. It's okay, genetic wise, it's okay. So we tend to stay back. Unfortunate thing is, I never seen his class with his friends. Maybe I would have caught it.
Right.
So when in first class, because this all started till 4 years, I think there was no problem. But when he reached his first class for the 2 to 3 years, 2 years, suddenly went to his first class, I see that he is at the shoulder level of most of his classmates.
Right.
That was a shocker for me.
Okay.
And that's when I realized there is a serious problem for him.
Yeah.
And 6 years, almost is crossing 6, he had issues. But only thing what he was working against is, according to me, thyroid means the child should be a little bit dull.
Yeah.
Okay. And memory should be a little bit on the lower side.
True.
He should be constipated. He should be having skin issues. He should be losing hair. My son had the opposite of all that. He had a thick hair, never constipated. He was very brilliant. He was very stable.
Right.
He was, he was hardly, never used to be very naughty.
Correct.
Understood? He was very stable and very mature for his age, and he used to stand almost on the top grades, get top grades in the class. So it was something which was pushing me against.
Correct.
And when I got his thyroid test, after seeing with his classmates, I was shocked. His thyroid was abnormally high. The TSH level was abnormally high. Me being a pediatrician, me also looking at various aspects, we can get confused because nothing comes like a textbook.
Correct.
That's when I think I looked back, and then I figured out that being stable and being very more mature than the age, not really being very naughty, is also not normal. So when we corrected his thyroid, his height got corrected. God's grace, he is now 6'1" right now. He's got a good height. There's no problem because on timely we diagnosed it.
Correct.
But he has become extremely naughty after that.
Okay.
It was very difficult for us to handle him. He became very notorious. He was crying. He was shouting. That was his normal thing. It's a thyroid which was actually masking it, which was a shocker for me as a pediatrician, because we read something else and we find something else. We learned out of experience.
True.
So height, I think, according to me, should be measured at every stage. It should be matched with weight, and if it is going below the line, they have to be checked.
Correct.
So that's the reason why we encourage parents to come regularly for a checkup. So coming to thyroid disorders, which is a growing concern among most of the parents. What are the things other than the example which I have given?
Correct.
Okay. What is the earliest age? Means what are the general signs of thyroid disorders? Very general. Means where the parents can pick up very easily by looking at it, and they have to visit their pediatrician if there is any concern.
Correct.
Okay. When is that you should do it?
So as you said, sir, that's what we do hear of all these textbook symptoms wherein there is constipation, dry skin, hair loss, mood changes. So very few kids actually present to us with these symptoms. Rather than more concerning problems, what I have heard from the parents is sometimes there is a rapid weight gain where I have seen. Second, height issues, sir, I don't see it in the beginning stages, because unless the hypothyroidism has existed for quite few months, then the height problem starts.
Okay.
So they may come with, as I said, rapid weight gain. And second could be slight academic issues, sir. But though I have seen even children with TSH more than 100 being still the toppers in their class.
Yeah, that's the confusing point, because we are always taught that anybody who is having thyroid problem will be mentally slow.
Correct.
So first question a pediatrician asks is, how does the child academically perform?
Right.
So the child can have a hypothyroid issue, but still can be academically really bright. That can be a blessing in disguise, because they will not be distracted.
Correct. Others would be, sir, sometimes parents say that my child is more tired in general. Usually many times it's after they come back from the school.
And appetite also.
Yeah, appetite also. Sometimes they say that not showing interest. I have seen not.
So there will be contrasting contrasting futures in my
Contrasting
experience. Mean the
features.
child
Yes,
here in
yes.
thyroid problem will not be eating much, but will be
Exactly.
gaining a lot of weight.
Gaining a lot of weight.
And will be
Yeah,
getting
yeah.
easily tired
Yes,
and wanted to
yes.
sleep a lot.
Correct. Sleep a lot. Sleep
Yeah,
a lot.
that
Yes,
is something
yes.
which I normally see.
So what I want to suggest is, like, like as parents are the first doctors. So you must trust your instincts, like, because you have seen your child, you know your child so well, that I feel that, like, the first thought or the first instinct that comes to your mind, you must follow it. And even if you have slightest doubt, then, like, I think we must
We must
like,
always
oh
visit
yeah,
them.
always